Good evening, my name is Michelle and I'm doing this speech on how to quit smoking. I want to ask a couple of questions first. Who here knows anybody that smokes? Who smokes? I know with my audience analysis that most of us here know someone that smokes or smoke themselves. I know this subject very well. I've smoked for 26 years and in the process of quitting. So the information will benefit you guys and also myself. I will provide information on statistics, how smoking affects the body, how stopping smoking can reverse the effects, what's in cigarettes, and how to quit. Let's begin with statistics. According to EDC in 2000, once you know the facts about smoking, it kills more than suicide, car wrecks, alcoholism, drug abuse, and suicides, and AIDS. Smoking is estimated to kill 4 million people in the last year. The experts estimate that within the next 40 years, 10 million deaths will happen per year from cigarette smoking. Secondhand smoking has the same risk as the people that smoke cigarettes, such as cancer, heart diseases, and SIDS. According to American Cancer Society, facts and figures, cigars and pipes are just as dangerous as smoking. They cause mouth cancer, larynx cancer, and esophagus cancer. Now that we know about statistics, let's see what's actually in the cigarettes. According to Koster in the book Teen Facts and Questions, published in 2012, there are 400 toxins that are in cigarettes besides nicotine. I want to ask you some questions before we get any further. Would any of you willingly ingest this Clorox bleach? Would any of you ingest willingly rubbing alcohol? Well, my question is, if we wouldn't inhale that on purpose, why would we inhale some of the things that are in cigarettes? One of the things that are in cigarettes besides nicotine is cyanide, which they use in gas chambers, formaldehyde, carbon monoxide, which is in car exhaust, ammonia, which is in household products, and arsenic, which is poisonous to our body. According to Kane, in Young People and Smoking in 1964, 1 to 3 milligrams is in one cigarette of nicotine. As much as 90% of nicotine is absorbed in our body. It stimulates the heart, blood vessels, digestive system, and kidneys. Now that we know what's in cigarettes, let's talk about the effects it has on our body and how bad it is for us. According to smokefree.gov, there are 18 ways that smoking can affect our body. We're going to touch on a few. The brain. Nicotine is like a heroin for our brain and the receptors of the brain. It craves it after we've smoked it for so long. Cigarettes changes your brain waves and how they cross. Withdrawals. You would be anxious, irritable from the cravings of the cigarette, like it runs your day. I know with me, like some of the main points of when I smoke, it's hard for me to eat and not smoke, or wake up and not smoke. So those are some of the things that I struggle with. Your head and face, you will have hearing loss, which was interesting to me. I've always had trouble hearing. My mom smoked, I smoked. So even as a child, I lost some, had some hearing problems from just the secondhand smoke. You will have night blindness while driving. That was also interesting to me about how you can't see just from the smoke. You can have mouth sores, ulcers, your teeth can fall out, bad breath. Who wants to come kiss you when you stink? You can age faster for having more wrinkles and more stretch marks than what you would if you didn't smoke. Your heart Smoking raises the blood pressure and it causes the blood vessels to constrict, which are smaller vessels and won't let the blood go through and can cause blood clots. It puts stress on your heart when you smoke. Again, it causes blood clots, and I know that too well. My mom smoked for many, many years and passed away from an embolic stroke from blood clot. Lungs, it causes inflammation to the airways and causes repeated infections of the lungs. Chest can feel tight from wheezing and shortness of breath, and it also causes a chronic cough. I have a smoker's hack when I wake up in the morning and cough and cough and cough until I've been up for at least 15, 20 minutes. Emphysema is a lung disease that is caused from smoking. Emphysema runs in my family, and it is hereditary, and causes a lot more damage to the lungs than what you would expect. I actually have some pictures I'm going to pass around. I don't know if everybody can see them. This is a healthy lung. Pass that around. And this is a smoker's lung after someone's been smoking. Now that we know the effects on the body that from smoking, let's look at the effects that it can have when you quit, the reverse effect. So according to smokefree.gov, the same 18 ways that it affects your body when you do smoke, it can reverse. The brain. Quitting can rewire your brain so it doesn't crave the nicotine. Levels will be returned back to normal. Your head and face, you will have less wrinkles. Your vision will improve from night blindness, and your hearing will also improve. Your skin will become clearer. Your risk for a heart attack declines within the first 24 hours of no cigarettes. Your blood pressure will be lower. The blood in your heart will be thinner and less likely to cause a blood clot. And your lungs, the scarring from the lungs will probably never go away, but your increase of a chance to have emphysema will decline. So even if you have scarring in your lungs, the chances of emphysema are lower every time a day goes by that you don't smoke. Now that we have looked at reversing the damage that cigarette causes, let's look at how we can quit. According to Olson C, If You Decide to Quit Smoking, published in 2006, there are 5 keys to quit smoking. Getting ready is the first key. Choose a specific date, a time that you're less stressed. I don't know when that would be. Choose a month in advance and prepare yourself. Seek support and encouragement from family and friends. Ask them not to smoke in front of you if they're a smoker, and have no smoking in your car, no smoking in your house, and completely away from you. So that way you're not even tempted to smoke. Skills for quitting. Learn to practice new routines. So like I said earlier, where when I eat, I get up, and after I get done eating, I smoke. So instead, after I get done eating, I can go for a walk, read a book, something different to rewire your brain. Be prepared to have withdrawals. You could cough more, which is a good sign because you're getting rid of the toxins that are in your bodies. You may feel dizzy from the extra oxygen that you're getting that the cigarettes took away. You may have some trouble sleeping at first due to the extra oxygen. There are also medications that can help you. I'm on Chantix right now, and there are several different things that you can do. You can ask your doctor to find what's best for you. And staying smoke-free. If you relapse, don't get frustrated, just try again. In conclusion, I have provided information on statistics, what's in a cigarette, how it affects your body, how the effects can be reversed, and how to quit smoking. I hope with this information that you're a better knowledge about quitting and know somebody that is wanting to quit, and you can give them this information to help them along their way. Quitting is hard, but it is manageable and it is doable. With hard work and determination, I know I will be smoke-free. Thank you for coming.